y'all know we're located in Newport. It's always a pleasure to get to come here and visit with some of the ladies and the guys who work, participate, and are a part of a great organization. And Sherry Hanley joins us once again. And Sherry, welcome back to the program.
Welcome, David. It's good to be back. We just finished our 7th annual watermelon eating contest last month. So this month, I thought we'd do like a personal interview with Bobby Williams, Kay Woodruff, and they've got some new job titles that we're really excited about. They've been part of our Lindley family for a long, long time, and we'll ask them what they do here.
Well, there's no doubt that you get new personnel from time to time, and we've talked with Bobby before. And Bobby, we'll start with you. Tell us job title, job description, and kind of what all that entails.
Well, my job title is Director of Nursing, and I oversee the day-to-day management of the nurses and the discipline. Yeah, that's.
Right, you got to have that. You got to have that.
Yeah, I've really worked on that.
Somebody's got to be in charge.
And one of the little nurses out front said to get my game face on. So I've been practicing that one too, and I'm not really sure if I got that down yet. But I'm working on the reputation of being really scary. So there I am. But no, really.
Tell us a little bit about you. Tell us a little bit
okay.
about high school and
Okay.
family and so on and so forth.
Well, of course, I'm a Newport girl. Went to Newport High School, graduated. I graduated from Harding with a BSN. My basic background is emergency room nursing, and about 3.5 years ago, this really wonderful nurse I know called and says, "Hey, you want a job at Lindley?" And I said, "Sure, I'll try anything once."
Absolutely.
Yeah, and I've been here ever since. It's been an amazing adventure. And that's enough about Sherry Hanley. But, this is an incredible nursing, holistic. We see every disease process, that you can imagine. So for anyone that's medically minded,
right,
it's a constant balance game of their medications and their labs, and then we are so blessed in this community because we have all these wonderful doctors that we can call and say, "Hey, my little resident down here, your resident is doing this," and let's do this,
right?
And so here at Lindley, we have encompassed more of, as well as this being their home, but we're doing more of IV therapy and antibiotics in-house instead of them having to leave and go into the hospital, which is really, really better process for them. They get, some of them will go to the hospital and they'll tell the nurses there, "I just want to go home.
Absolutely.
I just want to go to Lindley."
Absolutely.
And so that's what we do here. It's mom and pop. Sherry keeps us laughing all the time. She keeps TV people in here all the time.
That's right.
And we just don't know what to do.
A lot of fun,
no doubt about it. Every day.
A lot of
Every
fun.
day.
Kay, let me ask you, Kay Woodruff, also a Newport girl. Tell us a little bit about you, please.
Well, I've been here a couple of years now. I started my nursing career at the prison, and then I went into surgery. So my background is mostly a surgery nurse. I'm like Bobby, I got a call one day and said, "Hey, would you like to come work at Lindley?" And I had to think about it. And I never thought I could work in long-term care, but I love it here. And I'm glad I came. And it's real family-oriented. And I have small children that are in the elementary school here. And, they love to come hang out at Lindley.
Absolutely. Yeah. Well, let me ask you this. What made you change? What was the deciding factor? I mean, there's lots of things, there's money involved and salary and so on. But, what in your heart made you want to switch?
I don't know. I just think it was something different, and of course the call schedule with the surgery,
right,
and having the small children, and this being such a family-oriented place, where I can bring my kids and hang out at work with me if I need to. That had a big factor in my coming to Lindley.
All right, and as an assistant director of nursing, day-to-day operations, what do you kind of do during the course of the day?
My main job function, I would say, is over infection control in the building.
Okay.
And overseeing different conditions that people get, and how can we help prevent that or stop it, or make sure it doesn't spread throughout the entire building. I'm also her backup, so
Right,
she's
sure.
the good cop, I'm the bad cop.
And somebody's got to be that, don't they?
And we planned that.
Sure.
Yeah, I said, Kay, will you do this? And she, absolutely.
Sure.
I got it.
Sometimes the assistant has to do
Right.
jobs that are maybe not in the job description,
Yeah,
but jobs that
yeah,
have to be done.
yeah.
Right.
Yeah, good. Obviously, you guys make a great team.
Oh,
we do.
She's
Yes.
wonderful. I mean, she's a blessing to me.
Good deal, good deal. So, at Lindley, and we have fun here. We do lots of things, Sherry Hanley. Talk about some of the things that we've done in the past and kind of some of the things we're going to continue to do in the future.
Oh my gosh, David, I don't even know where to start because there's something going on all the time here at Lindley. Like I said, we just had the watermelon eating contest. We had the ladies' beauty pageant, 4th of July party. So now we're kind of gearing up for
Alzheimer's Walk, remember?
the Alzheimer's Walk that is scheduled to be in Jonesboro October the 8th. We're a big supporter of that. We will, as Team Lindley, support it and walk the walk, and we are currently...
And you can donate money.
Right. We're having fundraisers
Yeah.
for that. And then we'll be kind of gearing up for Halloween, Fall Festival, then Thanksgiving, then Christmas, and I don't know, I may throw in a few surprises. You never know.
Oh yeah, I know. You talk about donating money. How do you do that? How do you do that? How do you donate money? Is there a phone number? Or do we know how we do it?
Yes, if anyone is interested in donating to the Alzheimer's Research Fund, just contact me, myself, or Gerald Carlisle here at Lindley at 870-523-6539, and we will make sure it gets to the right place.
Ladies, have we covered all the basics in nursing that we need to talk about today, or is there something else that we need to add to this particular interview?
Well,
I guess we've covered it all.
yeah, because anything else would be HIPAA.
That's correct.
We can't be talking HIPAA.
No, we don't need to.
Yeah,
we don't need to talk any HIPAA.
No, not on TV.
Absolutely. We appreciate y'all taking time to visit with us, and no doubt that the nursing department here at Lindley Health and Rehab is in fine hands with these two Newport Greyhounds sitting to my left and this young lady to my right, Sherry Hanley. Thank you, ladies.
Thank you.
Thank you.